Okay, let's go ahead and get started. Good morning, everyone, or good afternoon, or good evening. Welcome to today's webinar on managing immunization supply chain performance. This is Greg Roche, and I'm here again with my colleague Barbara Lamphere, and we're both very happy to be with you again to present today's topic. Before we begin, we'd like to address a few issues that arose from our first webinar. We had some requests for this topic to be presented in French, and we will explore options for doing that. But for now, unfortunately, we can only do the presentations in English, and we thank you for your understanding.
As an alternative, we have started an open, non-moderated discussion on the International Association of Public Health Logisticians, IAPHL platform, and we encourage everyone to participate in that. For those who are not already members of IAPHL, here is an introduction to IAPHL and a link to the website where you can sign up to become a member. It's free and open to anyone. On IAPHL, you have the option of choosing any language you wish from a limited number of languages, but also including French, to view the IAPHL discussion groups and website. We will also include the IAPHL website link in our follow-up email after this webinar. I also would like to let you know that the game that is associated with this webinar series is now also available in French. So we will try to do our best to accommodate our Francophone colleagues.
As with the first webinar, we will try to leave time at the end for some questions. For that, please use the QA function that's circled in red by clicking on that QA button at the bottom of your screen, rather than sending questions using the chat function. We will not be able to monitor those chats. So let's now get into today's topic.
This is our second webinar in the Immunization Supply Chain Leadership webinar series. We want to welcome those who are joining us for the first time and thank all of you for investing your time to learn more about supply chain leadership. Just a brief introduction about ourselves. I am a senior technical advisor with JSI. For the past 30 years or so, I've been working with individuals and organizations to improve their supply chain capacity across a variety of areas. Great, let's hear about you.
Yeah, I'm also a senior technical advisor, and I've been working most of my professional life in the areas of performance improvement, capacity development, and organizational development, and all of that in the context of supply chain for the last 20 years. Here are the objectives for this webinar on managing immunization supply chain performance. We'll start with a look at key performance indicators that we can use to measure the performance of our immunization supply chain, along with the data required for those indicators, and where we can get the data that we need. We will focus on a set of indicators called the DISC indicators. For those who are not familiar with the DISC indicators, DISC, D-I-S-C, stands for Data for Immunization Supply Chain. These indicators were developed and approved by the Gavi Alliance partners in 2015 to be used to monitor in-country immunization supply chains. The indicators are intended to be implemented at each level of the supply chain and collectively provide an overview of the performance of the essential elements of the immunization supply chain. An advantage of these indicators is that they require simple data points, which allow them to be used in settings with different degrees of data availability. At the end of this section of the webinar, and in the follow-up email after the webinar, we will also provide you with a link to reference documents on the DISC indicators. Getting back to our session objectives, after we look at some indicators, we will look at how we can use data visualization to identify performance challenges. We will then look at data review teams and how they can be used to monitor indicators and improve supply chain performance. To increase our interaction, as we did last time, we will also invite you to participate in a few polls during this webinar. We have a lot of material to cover, so let's get started.
So now let's first look at key performance indicators. Here is the standard definition of what a key performance indicator is. Key performance indicators, or KPIs, are critical or key indicators of progress toward the intended result. KPIs provide a focus for strategic and operational improvement, create an analytical basis for decision-making, and help us focus attention on what matters most. As Peter Drucker, that important business management consultant, famously said, "What gets measured gets done." If you attended the first webinar on strategic planning, you will see that the key performance indicators will help us to assess how we are doing in terms of achieving our strategic goal, strategic priority, and strategic objectives. We're going to start with a poll now, a quick poll, and this poll is going to include a list of key performance, a list of characteristics of key performance indicators. Please look at this list and indicate which do you think are characteristics of a good key performance indicator. Choose those characteristics you believe are true of a good key performance indicator. Go ahead, choose which of these you think are true of key performance indicators. All right, I have 52 people here. I hope to see at least 52 possible people answering questions or providing your opinions. All right, I'll give you a few more seconds. Great. Okay, I'm going to end the poll now. Let's share the results. All right. Well, it looks like most everybody said that, or many of you who responded said that key performance indicators measure what is intended to be measured. And I hope that's true for all of them. As a matter of fact, all of these characteristics are characteristics of good key performance indicators. Key performance indicators should provide objective evidence of progress. They should measure what is intended to be measured. They should help inform better decision-making. They should also offer a comparison to gauge performance change over time. And key performance indicators should track efficiency, effectiveness, quality, and other aspects of performance. So all of these characteristics are part of what a good key performance indicator should be.
Here are the DISC indicators that we referred to a moment ago, indicators that we can use to monitor the performance of our immunization supply chain. We can observe that the Gavi Alliance partners focused on 7 indicators. So a small set of supply chain performance indicators that they felt were most important. As we will see later, we may need to limit the number of indicators that we try to track, and you might also track indicators that are not among these 7. Everything will depend on the data that you have available and the performance objectives you are trying to achieve. We can also observe that among these indicators, the 4 that are highlighted here can be used to assess or monitor the performance of any supply chain: vaccines, HIV/AIDS products, malaria, reproductive health, or any program products, or for an integrated supply chain that manages all or a number of product categories.
Then we can see the others. The ones highlighted here are more specific to vaccines and cold chain. You might also recall from our last webinar that the first two of these highlighted indicators, the closed vial wastage and functional status of cold chain equipment, were among those that were included in the Ethiopia Immunization Supply Chain Strategy. Beyond the DISC indicators, there are also many other supply chain indicators that we can monitor. Here are some other examples. Again, the indicators that we track will depend on which we feel are most important to improving our supply chain performance, which ones we have data for, and how much work our staff can do related to data collection and analysis.
There are even more and more indicators that we could track, such as those seen here, and probably tens or even hundreds of others. However, we need to be careful that we are not measuring too many indicators. This might distract us from the most important indicators and would also require a considerable amount of data collection. Remember, we try to focus on data for decision-making. Only collect the data that we need and use for decision-making. Don't collect data simply because it would be interesting to know. Remember, it is usually the service providers who have to collect all the data in addition to their other tasks.
Related to indicators, and as we just mentioned, we also need to think about the LMIS, the Logistics Management Information System, or data collection system that will inform the indicators. What data is coming from where, and where is that data going, and for what decisions? So here we have a flow chart of a supply chain system. You see the flow of information. We might find that some indicators can be assessed monthly as data is received monthly, others quarterly, and even others semi-annually or annually. This will depend on how often we will be making decisions or taking action on using that data that we collect. Technology might even permit data to be collected daily, such as the case of cold chain equipment monitors that automatically send a text message if the temperature gets too high or the machine breaks down. In summary, we need to ensure that our information system is providing all the data that we need to assess our indicators, and that the information is coming at the frequency that makes sense for each of the indicators that we are tracking. Let's look at two indicators in more detail. We will be providing you with a reference for all indicators after the webinar.
Let's look at one of the DISC indicators, closed vial wastage. We see in the definition that closed vial wastage can be measured during a particular time period, such as per month, per quarter, and so on. We also see some of the conditions of wastage, such as expiry or different kinds of damage. Closed vial wastage is different from open vial wastage. The two numbers should not be combined, as they are different indicators. For the data that we need, we have the number of discarded doses and the number of doses under management, and we apply the formula shown to calculate closed vial wastage. The answer will be in a %. For reference, from WHO document, Monitoring Vaccine Wastage at Country Level Guidance, the WHO UNICEF Effective Vaccine Store Management Initiative on improving vaccine management practices in primary and intermediate vaccine stores, details the calculation of proportional vaccine wastage in unopened vials in vaccine storage facilities, and it considers 1% wastage to be acceptable. So as a quick example, if we have 370 wasted doses during the month and our total quantity of doses managed during the month was 4,600, then our closed vial wastage rate would be 8.04%. To know if this is good or not, we would want to know the historical wastage rate and the program's target for closed vial wastage. Let's try a quick poll. Think about your program and your supply chain. What is the current closed vial wastage rate for your program? 0 to 5, 6 to 10, 11 to 15, 15 or above, or I do not know. And it's fine to answer I don't know if you don't know.
And remember, this is anonymous.
Yeah. So take a minute, take a minute. Another 2 seconds. Anyone else care to vote? Okay, we'll stop it there. And it looks like it's not a majority, but what's that? A plurality of folks are in the I do not know category. So maybe we want to try to collect some of that data on the number of closed vials wasted and the total number managed, and then you can get an idea of your closed vial wastage rate. After that, it looks, congratulations to all the folks who are in the 0 to 5%. It looks like you're close to that WHO indicator of 1%. And then for the others, maybe we want to see what we can do to try to reduce some of that closed vial wastage. So thanks everyone for participating in the poll, and let's keep going. For the sources of data that we need to calculate closed vial wastage, that data might come from one or more of the data sources that are shown here, depending on the data that is collected in our information system, either the logistics information system or the health information system. But it's important to remember that if we want to calculate closed vial wastage, then we must have a means to collect the data that we need to calculate that indicator.
Let's look at another example DISC indicator, functional status of cold chain equipment. This indicator tells us the proportion or percent of our cold chain equipment that is functional. According to the definition, it includes all types of cold chain equipment, including passive storage devices, which are those for which there is no need for electricity, such as an insulated carrier that can function using only ice. And as mentioned, and as with many indicators, it can be measured at a point in time or over a period of time. In terms of the data needed, we need the total number of cold chain equipment devices, the functional status of each, and the reason for not functioning or not in use. While we can calculate the overall percentage of functional equipment, we want details such as status and reason for not functioning so we can look at various disaggregations. But more importantly, so that we can identify the actions that need to be taken to bring the non-functioning equipment into functioning status or for replacement. So we want to know what all the total number of devices are, and we want to know how many are functioning and the functional status of each. The formula shown here is for the basic calculation for the percent of cold chain equipment functioning at a point in time and without disaggregation related to functional status or primary reason for not functioning. So continuing this example of the basic calculation, if these are our numbers of total cold chain equipment in the district, you see all of these different possible kinds of cold chain equipments, and the number of each that are functioning, then the overall percent would be 88.7% cold chain equipment functioning. Again, in order to take action, we would need to know that what the specific status is of each non-functioning piece of equipment. Are they non-functioning because of poor maintenance, because of the lack of spare parts, etc., so that we would know what action to take. As with data sources for the closed vial wastage indicator, there are many different sources for the various data needed to calculate the functional status of the cold chain equipment indicator. And this will depend on your information system. As we see here, you may have a maintenance worksheet or cold chain inventory, and there's some way of assessing an assessment checklist for your equipment, etc. But as with all this and all indicators, if you want to be able to measure the indicator, you must ensure that your system collects and reports the needed data.
Let's do another quick poll on indicators. So here are the 7 DISC indicators that we saw earlier, and we're asking you to use the polling screen to indicate which of these indicators your program measures. So please take a moment to indicate. Which of these indicators does your program measure? Take another few seconds. Okay, we're going to have to stop there. And let's see what we have. So it looks like, wow, okay, so most everyone who voted, 73% functional status of cold chain equipment. That's the top. Full stock availability, and then going down on time and in full delivery, closed vial wastage, and then so forth. So congratulations. It looks like a lot of people are tracking several of these indicators, which is very good. So keep those in mind. And again, we'll share information about those indicators after the webinar. Here are a couple of useful links related to the DISC indicators and data management. And again, we will share this information with you after the webinar.
Let's now talk briefly about how we might use data visualization to help us interpret the data related to our immunization supply chain indicators. There are many ways we can present or visualize our data to help us in our analysis. The way that we visualize our data will depend on the quantity and type of data we are looking at and the type of analysis we are doing. For example, if I am comparing one indicator across facilities for a specific time period, I might choose a table or a bar graph. If I am doing a comparison over time, then I might prefer a line graph so that I can easily see trends. Depending on the situation, you might even come up with more imaginative or visually creative ways to present your data. However, we want to be sure that our data visualization facilitates and does not distract from our ability to do the analysis. You can see that the amount of detail or the way the data are presented in these examples is actually distracting and will not help us do any analysis or draw any conclusions. We will include some guidance on choosing types of data visualization in our follow-up email.
Here, excuse me, here are some sample data for the indicator closed vial wastage. We have the same data presented in a graph format and in a table format. You might prefer one format over the other. The graph lets us see at a very quick glance what the status is over time. The table format lets us include a bit more detail. We probably would not include several data points in a single graph. Looking at this graph, I think we can agree that an alarm goes off for the month of June. We would want to know what caused that spike, that increase in closed vial wastage in June, and then take any needed actions. For functional status of cold chain equipment, we again see some sample data. Looking at these data, we might want to better understand why the functional status for passive storage devices is so much lower than for that of other types of devices. Again, we need to explore and understand the reasons for the numbers so that we can take action. And we also need to know what our targets are for each indicator to know if we are underperforming or not.
Speaking of finding the cause of problems seen in the data analysis and thinking about our targets, our third topic of the webinar is data review teams. These teams play a role in collecting and analyzing supply chain and other data to measure supply chain performance indicators. They use the information to identify supply chain problems and make supply chain improvements that have a positive impact on the performance indicators. In other words, they are using the data to measure the indicators with the purpose of improving the performance of our supply chain and to improve product availability.
Here are some health goals that we might find at the national, regional, or district level in a country. Take a moment to read through the list. Okay. And I think we all agree that in order to achieve our health outcomes and goals, we need to have an effective and efficient supply chain that will provide quality products as, when, and where they are needed. In order to focus our attention on achieving an effective and efficient supply chain, then we can think of a data review team as a system of connected teams that work harmoniously together to achieve a common goal, share experiences, and have a strong effect on the supply chain. Data review teams have been implemented in several countries and have realized supply chain improvements as a result of these actions, a result of the actions of these teams, excuse me. Different countries have chosen different names for their data review teams. You may have a data review team already established in your country. For example, in some countries, they call the data review team an impact team, based on the acronym shown here. In some countries, they call the data review team a QIT, a quality improvement team, and this relates to the team's purpose of improving quality. Yet other countries might choose the name Visibility and Analytics Network for the reasons shown here, to focus on data visibility and analysis. There are many other possible names for what you might call your data review team, including you might even call it simply our data review team. But regardless of the name, the purpose is the same: to analyze data, measure indicators, and focus on action to improve our supply chain, to work towards supply chain excellence.
Here are some of the likely outcomes that your supply chain, your system, or your program might experience if you are able to implement the data review team concept. Like the first likely outcome is that you'll improve your skills around using data. The second one is you're likely to have better data quality because as people begin to use data, they focus on improving the quality of the data that is used. It will lead to better decision making. We'll have increased supply chain performance, motivating people to focus more on the data. And the supply chain improvements themselves, data visibility, stock availability, and reduced wastage. Let's talk a few minutes about how the data review team might work. Data review teams may meet monthly or at different frequency and use an approach called Innovate-Do review, or a similar process that covers all aspects of data analysis and use for supply chain improvement. In this example approach, they go through the process of identifying and prioritizing problems and finding the root causes of those problems and problem solving. Then the next step is to plan for and implement improvement actions. And then after those actions are taking place, they monitor their performance and recognize improved performance using those indicators by which to measure the improvement in their performance.
In order to help ensure that the Innovate-Do review cycle is implemented, teams are encouraged to follow a standard agenda for team meetings, shown here, as well as to have a leader who ensures that actions are implemented between meetings. We might ask ourselves, why is it important to have a standard agenda? And the answer to that question might be to ensure that the meeting is efficient, to allow members to bring the right information to the meeting, and to ensure that key or pertinent issues are discussed.
As the data review teams go through the meeting agenda, they will be doing this series of 5 activities. They will review their recent performance in relation to their indicators. They will identify underperforming indicators and issues that are negatively impacting the indicators, identifying those performance problems. They will look at and determine the root causes of these problems, develop an action plan to address those root causes of the problems they've identified through the indicators. And then after they have implemented the problems, they will recognize achievements and improve performance and provide support and motivation to others to do better.
In between the team meetings, the team members will continuously collect and monitor data on supply chain performance. They will implement the actions that they have identified to make supply chain improvements. They will engage partners or others as needed to resolve supply chain issues, and they will document their actions, results, and any problems that they faced. This is a summary of the process that is used to mobilize and implement the data review teams, from getting the green light to implement the teams, deciding the level or levels at which the teams will be established, then training, providing support as needed as the teams get going, and then assess the impact of the teams. What results are they seeing? We should also mention that while teams can be established at any and all levels of the supply chain, the farther down the supply chain the teams can be found, the more supply chain improvements can be realized. At the same time, teams working in isolation at the lower levels would have less chance of having an impact on the overall supply chain in the country. In other words, local teams can make improvements locally, but it would be difficult for them to address or resolve problems that exist at the higher levels. If there is a countrywide stockout of a product, a local team will have very little influence on resolving that problem. We also need to think about which supply chains our team will be concerned with. All products or programs in an integrated system, or one team for multiple vertical supply chains, or even a specific individual team for each vertical supply chain or set of products.
So we have been talking about where these teams are located, whether they're located at the local level, meaning within a health facility, or maybe at local and district level, or at national local district or health facility level. Here are some of the examples from different countries where data review teams have been implemented with the support of different partners. You can see that there is some variety in where the teams are located. I'll give you a few minutes to look at this. Sometimes the teams are located at the province only or the district only, or there could be combinations of levels or teams across levels, such as the case here in Tanzania, Kenya, and Pakistan, where data review teams have been used across multiple levels to help improve supply chain performance. And remember that these teams are always focusing on using the data to measure those indicators and determine what the problems are and why those indicators are not improving over time. In this next chart, you'll see that this shows a variety of country implementation of data review teams by the product or program. So you can see which countries are now using data review teams for looking for management of their vaccine supply chain, and using those indicators to take in the teams to determine what actions to take to improve their performance. This slide shows the country implementation of data review teams by product and program. In some countries, the data review teams are concerned with all products for all programs. Sometimes they only track a small set of tracer programs, because obviously in a large integrated program, you may have hundreds of products, so it may be hard to track the indicators for all those hundreds of products, so you choose some tracer products. And sometimes the team has responsibility for and sometimes the teams have responsibility for multiple product categories, or they may just be for a single product category. But you'll see that there are quite a few varieties of countries that are doing different things. So in Ethiopia, when we talked about Ethiopia in the last webinar, we talked about their integrated system. You'll see that they have data review teams that address all the program areas in an integrated manner.
When establishing your data review teams, it is important to consider the competencies and the skills that are needed to make up the best teams. Some examples of the types of people you may want to include in the team are shown here. Teams are encouraged to select membership by skill set and by competency, and not based on job title alone. For example, in one district in Guinea, they selected a young district staff member who was good on computers to convert the data to useful graphs for analysis, even though he was not a pharmacist nor a supply chain expert.
As the teams are getting organized, they should focus on a few key startup activities as shown here. Most importantly, they should identify their indicators and set targets. At the outset, each team should also develop its performance recognition plan so they are ready to recognize improvements as soon as they are made. Recognition of improved performance is a key element of the team so that members are continuously aware of and motivated to improve performance, motivated to use that data to identify problems and improve performance. Some teams will reward improved performance with a low-cost gift or show appreciation at no cost. A low-cost recognition may be getting a nice pen or notebook, and a no-cost recognition may be a round of applause at a team meeting. The indicators that teams establish should be agreed upon at the higher level so that everyone is working towards the same indicators, the same goals. The targets should be, but however, even though the indicators may be set by the program or at the national level, the targets should be locally based on the local context based on their priorities and the potential for improvement at that level. Since the targets are set locally, the levels of improvement to recognize will also be more specific to each individual team.
Aside from the DISC indicators that can be used to monitor vaccine supply chain performance, here are some other supply chain performance indicators that are typically assessed by the data review teams. For example, the teams in Guinea, Myanmar, Kenya, Ethiopia, and others monitor some or all of these indicators shown here to track supply chain performance. So we might ask ourselves, what do I gain? What can happen to the supply chain or product availability if we take the time and make the effort to implement data review teams? Here are some results from one state in Myanmar. We see an increase in reporting rates from 79 to 100%, a decrease in stockout rates from 54 to 27%, and an increase in stock adequacy, which for them is stocked according to plan, from 14 to 37%. For some sample districts in Pakistan, we see overall decreases in stockout rates and some reductions in wastage. So to summarize a little bit from the webinar, our data review teams can use data visualizations for any of the indicators that it is focusing on to identify supply chain issues and then work towards solutions. When we looked at our sample data for closed vial wastage and percent of functioning cold chain equipment, we were able to use visualizations to help us to identify challenges and areas for improvement on those two indicators. For the country examples, after implementation of data review teams, we focused on the improvements that they realized, but we can also observe that the initial data showed weaknesses in those indicators. So again, areas for potential improvement in the areas of reporting rates, stockout rates, and stock availability.
This is the end of the webinar. Today, we have identified key performance indicators for managing the performance of an immunization supply chain based on the DISC indicators, the data required to inform those indicators, and the sources and tools used to collect that data. We've listed common supply chain performance challenges identified through the data visualization of key performance indicators. And we've explained the role of data review teams and the process they use to improve supply chain performance at the local level. We now have some time to answer some questions, and it looks like we have about 10 questions that have come in from the group so far, and I'm going to try to do these in order. And it looks like some people have already answered some of the questions as well. Is closed vial wastage similar to wastage factor? So closed vial wastage is similar to wastage. If you're talking about wastage factors such as losses, as in one of the key, the essential data items, or the losses lost due to damage or expiry or theft and so forth, closed vial wastage would be similar to the wastage factor in that it is its number of doses lost from a vial that has never been opened, and that it is therefore it was probably the wastage could be due to things such as inappropriately stored in high temperatures and so forth. So it could be a number of those things. Yeah, so I'd say it's similar. Greg, you have anything to add to that?
Yeah, I will. This also anticipates a couple of the upcoming questions. The other side that you can also take about wastage factor generally, there's also the open vial wastage, which is particular to vaccines. And this is the one where, let's say you have a 10 dose vial, you open it to give a vaccine and you only use 3 of those doses. The next day or a day later, the vaccine is no longer usable and you have to throw away 7 doses because you can't use them anymore. That's a different kind of wastage. That is open vial wastage, which, as we saw in the definition, is a separate indicator. There's open vial wastage and closed vial wastage, 2 separate indicators telling you 2 separate things.
Mm-hmm. The next question is it common to include passive cold chain equipment functionality among functional cold chain equipment? In my experience, they're not mostly included. Greg, do you want to take that one?
Yeah, I think when we saw in the definition, according to the indicator, what you want to do is to know the status of all of your cold chain equipment. And because passive cold chain equipment is a type of cold chain equipment, we would want to know the status of those pieces of equipment. Based on the question, we're saying typically people do not track that indicator or track that equipment. I think what we're encouraging people is to add that to your tracking of cold chain equipment, especially if you have a lot of community-based workers or so on who are using passive equipment. You really want to be able to know what's the status of that.
Mm-hmm. Valerie is adding to this question as well. She said cold chain equipment functioning, the source of data is regular updated cold chain equipment inventory, and if that's not existing, it's very difficult. It is true that having an inventory of the actual cold chain equipment and having a system for updating that inventory, that's very, that's an important system to establish. We'll be talking a little bit more about cold chain inventory and having a way to manage the cold chain inventory in the webinar on cold chain equipment that will be taking place in March. So we will get more into that cold chain functioning and how to keep an inventory system to do that. But it does take that extra effort. Let me see. let's see. I'm trying to figure out which questions we are. Regarding cold chain, how do you monitor, get that data? Okay, I think we've been just talking about that. How do you determine the allowable wastage rate? And I assume we mean the closed vial wastage rate. That was from Timmy. Greg, do you want to? I think that allowable wastage rate is something that you need to, you know, the WHO recommended rate was 1% if we're talking about closed vial wastage. But, you know, I think the important point is that you are always trying to set your baseline and improve it, and, you know, allowable, you know, wastage rate, you know, see what's reasonable and doable, and, you know, strike for excellence and performance. Greg, would you like to answer this question?
Yeah, just to reinforce what Barbara says, if we think about the poll that we did on closed vial wastage, we saw that some countries were up in the 15%, others were down in the 0 to 5%. So again, that WHO target is maybe 1%, but you also have to think about what's realistic for your country and what's historical. If you're typically, you have 15% and you're able to make some improvements and get that down to 8%, I would congratulate you.
There's a question here. I'm going to just change our discussion a little bit. Is it common to form a data review team under a technical working group, or TWG, instead of having separate data review teams? We tried that in Ethiopia, as there were a lot of teams and TWGs. Sometimes in some countries that I have worked in, the actual technical working group will have, and it depends what type of technical working group you have, but they will have a subcommittee that is looking at supply issues, and that supply issues subcommittee of the technical working group will become the data review team. Usually those TWGs are at national level, and so that's what at the national level is. But I want to reemphasize that data review teams can be at any level of the system, and we've had great success with data review teams at local levels, whether they be health centers or health centers working with districts or townships or whatever, however your administrative structure is. And those data review teams are able to use the data that they're collecting locally and say, well, how did we do last month? This is what our performance is just with the data that they're collecting locally against a set of indicators, and then look at what they're doing within their facility or within their district and do those improvements there. So obviously you don't have necessarily those aren't TWG instances. So you can have data review teams under things, but in many different kinds of forms. But you can have them as part of a subcommittee of the TWG, because it does get a little overwhelming to have a lot of, particularly at national level, there are a lot of TWG kinds of activities that are happening. There's a question about standard ways of measuring performance indicators for cold chain equipment. We will send you some indicators and some references for other indicators but I think for when we get to our webinar on cold chain equipment, we will get much more specific into those indicators on cold chain equipment maintenance and repair as well. Is there a downfall of overlooking, oops, just jumped. Is there a downfall of overlooking supply chain specialists when it comes to capturing technical skill set, as there can be supply chain analysts? I think, Greg, you were mentioning the makeup of the technical makeup of say, a data review team, or whether or not you need to have supply chain specialists in that team and so forth. Do you want to comment on the technical skill set?
Sure. I think going directly to the question, if the purpose of the team is to make supply chain improvements, then you necessarily require a supply chain person on your team. I think it would be difficult for non-supply chain people to propose solutions or even to identify supply chain problems if they don't have a good understanding of how the supply chain works and what the issues are related to supply chain. I'll just think for an example, if we're thinking about supply chain performance indicators, maybe the people who don't do supply chain will not realize what data is needed in order to assess those indicators. So yeah, I think having a supply chain specialist on your team is key.
Well, I thank you for your questions, and I'll review the questions that we didn't get to and see if we can start a discussion on IPHL on those. I would like to remind you all as we wrap up this webinar that you will be receiving a follow-up email with links to the references that we have mentioned here, and also a link to the gaming app. We've had quite a few people started participating in the game, and their scores are mounting up. So I encourage you to participate in the Immunization Supply Chain Leadership game. And use the app to review the content of today's webinar and of the last webinar. And remind you that the game is also available in French. And then when we finish this webinar today, you will be receiving an evaluation form to help us improve future webinars. We hope that you will be able to participate in the next webinar on managing your immunization supply chain team. That webinar will take place on Tuesday, November 12th at 1300 GMT. And I will include a registration link for that particular webinar in November on the immunization supply chain team in the follow-up email as well. Many thanks again for joining us, and we wish you the best. Take care. Bye.
Bye.